Ladies and gentlemen, welcome from the University of Mainz in Germany. My name is Carsten Keller and my colleague Dr. Hobum will present you some data and results about survival benefit of obese patients with pulmonary embolism. This paper was published in Mayo Clinic Proceedings journal, and we will present you now the data and the results. Obesity is an established risk factor for cardiovascular diseases. However, studies and meta-analyses have demonstrated a better prognosis for obese compared to lean patients with cardiovascular diseases. However, only a few studies have investigated the so-called obesity paradox in pulmonary embolism in PE patients, and the prognostic impact of obesity in PE remains controversial. We aim to investigate the influence of obesity and underweight on adverse in-hospital outcomes in PE patients.
To our methods, the nationwide inpatient data source of Germany containing diagnosis of inpatients provided by Federal Statistical Offices of Germany, and this was used for the present study. The source was the RDC of the Federal Statistical Office and the Statistical Office of the Federal States in Germany, DRG Statistics 2011 to 2014, our own calculations. Patients aged at least 18 years diagnosed with PE between 2011 and 2014 were included in our analysis. Obese and underweight patients were compared to patients without abnormal body weight, and obesity was further stratified in classes 1, body mass index 30 to below 35, 2, 35 to below 40, and 3, above 40.
Overall, more than 345,000 inpatients aged at least 18 years were diagnosed with PE in Germany between 2011 and 2014. Of those, 29,000 patients, 8.6% of all patients, were obese, and 1,675 patients, 0.5% of the patients, were underweight, as shown in Figure 1 and our flowchart of the study. The reference group of patients without abnormal body weight included more than 90% of the patients. These were 340,339 patients. As shown in Table 1, obese patients were younger, more frequently of female gender, had less often cancer and more frequently heart failure compared to the reference group. Notably, obese patients were more often treated with systemic thrombolysis and surgical embolectomy.
In total, 51,000 people died during the in-hospital stay. Interestingly, obese patients had a low mortality rate with almost 11% compared to the reference group with 50% of patients with normal body weight or overweight, and a reduced risk of in-hospital mortality. This was confirmed in the multivariate regression analysis with an odds ratio of 0.74, independently of comorbidities and reperfusion treatments, as shown in Table 2. This survival benefit of obese patients was more pronounced in obesity classes 1 and 2. Finally, the survival benefit of obese patients was also evident in the subgroup analysis focusing on patients with cancer, on the red line in Figure 2a, and heart failure in the red line in Figure 2b. The blue line represents all included PE patients, while the green line in Figure 2a shows patients without cancer, and in Figure 2b those without heart failure. At the other side of weight spectrum, underweight patients showed a higher prevalence of cancer and a higher case fertility rate.
So let us conclude. Mild and moderate obesity was associated with lower in-hospital mortality rate in PE patients. Although obese patients were more often treated with reperfusion treatments, this obesity survival benefit was independently of age, sex, comorbidities, and the treatments.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.